Welcome to Bonding and Beer, episode 24. My name is Rolando Nunez, and today's topic is post-op sensitivity, and we have a special guest. Let's freaking go! I gotta dance. Let's go. What has Rolando been up to? Well, let me tell you, my friends, I'm a human being. And that means that I am, prone to break down. I am an old human being. So guess what happened? I needed gallbladder surgery. You know why? Because apparently there are these things called gallbladder stones. So I had some of those deposited in my gallbladder, so that had to be removed. I went through surgery successfully because I am basically a trooper, a road warrior, okay? I got my surgery done. It took about 35 minutes, and they pumped a ridiculous amount of drugs in my body in order to avoid the pain. Now, as soon as I got out of the surgery, they were giving me instructions. My wife was there. I couldn't hear anything because I was groggy, okay? But they gave me some medication, some hardcore narcotics, oxycodone, the ones that make you loopy. So, fair enough. We needed to stop by the pharmacy. We did. My wife gets out of the car. She goes to the pharmacy, picks up the medication, gives me a little baggie, Walgreens baggie with the medication. We get home. She asked me, how you feeling? Said, I need some of these narcs. And she gives me a pill. I open the bag. I give her the vial. She gives me a pill. It don't work. It doesn't work. Pain is horrible. And it's not working. 8 hours later, she gives me another pill. How you feeling? He said, I got to tell you, this oxycodone, this is not helping. And then the doctor has said that I can take some ibuprofen on top of this if the pain was too much. I took ibuprofen. It wasn't helping either. Nothing was helping. This was on a Tuesday. Wednesday, same thing. She gave me one pill every 8 hours. She woke me up at 3 o'clock in the morning, gave me a pill. Nothing is working. On Thursday noon, she comes to me and gives me the vial. She says, this is your fault, and hands me the vial. And I read the vial, and it said vitamin D. She had been giving me vitamin supplements instead of narcotics for my gallbladder surgery. How does this happen? Well, apparently, I have a vitamin D deficiency that they found out when they did the blood work, and they prescribed a 50,000 unit vitamin D supplement. Not a supplement. This is pure vitamin D. Now, mind you that the amount of vitamin D that you need is only about 1,000 units a day. I am pumping 150,000 units a day for almost 3 days. Now I have a vitamin D overdose. This is crazy. And I am in pain. Now, my wife is basically, how do I say this in a nice way, poisoning my with vitamin D slowly, killing me slowly. It's crazy. I had to call the doctor and ask the doctor if, hey, I have this vitamin D overdose. What are the side effects? What's going to happen to me? And can I take the narcotics? Because all I care is about the pain. Now, they called me and said, stop taking the vitamin D. You're going to flush it out. Start taking your painkillers. Life is good. We're back to normal. And you know what? Let's talk about post-op sensitivity with our guest. Let's freaking go. Today's topic is post-op sensitivity. And yes, I do know, I am aware that we've developed an episode where we talked about this topic. But I believe that post-op sensitivity, it's a thing of a conversation. Having conversations with different clinicians from different parts of the world with different experiences and different, amounts of time that they've been practicing. provides a different take on a totally theoretical, academic point of view of what post-op sensitivity is. So it's important to have the clinician's point of view, and this is what we're going to do today, and this is why we invited Patrick. So I'm going to do a little bit of an intro here. Who is Dr. Patrick Calalang? I'm not going to, go here and start talking about his resume, but I will tell you how I bumped into Patrick Calalang, how he became part of what I do. I met Patrick during the pandemic, basically on social media. And during the social media lockdown, everybody dealt with that in a different way. And one of the things that I decided to do was to look at what other people were doing and posting on social media, but that was actually meaningful, and trying to go beyond the layers of, oh, I'm doing this because I'm bored, or I'm doing this because this is a good opportunity to increase my, my follower count, and look into people that were really willing and wanting to just share information in an interesting way. And I bumped into Patrick's social media account. And it was insane because there was detail, there was beautiful dentistry, there was engagement. He took the time to answer the questions that were being asked publicly. And I'm assuming, and I will let him develop this, that he had a lot of, private questions also. So I thought that was super, super cool. I want to say that we connected during the pandemic, and then we kept in touch, and he's from Arizona. He has a successful practice over there. And we started chatting and talking and looking at ways to work together. Patrick has come to Bisco. He has he's been part of the Bisco experience element of the Bisco training program. And every time I go somewhere and Patrick is there, I make it a point to share with him and spend the most amount of time I can with him, because he is just a great individual, great clinician, and it's an honor to have him here, and you guys are going to enjoy this. Okay, guys, so I have Dr. Calalang online. How you doing, Patrick?
Doing good, thank you. Thank you for having me. I appreciate the invite.
All right, man. Why don't you give us a little bit of a background of yourself?
Well, you pretty much said it better than I could say it, but yeah. So I've been practicing, 32 years now. And so 32 years, I'm not a researcher. I don't write papers. I'm a wet-fingered dentist. I do what most of the people out there are doing. I'm in the trenches every week, just like them. So I've seen it all from 32 years ago up to now. So I just love doing it, though.
You just happen to do it a little bit better, huh?
I don't know about better, but always trying to get better.
100%, my guy. Now, I want to say that, we want to thank you for the gift. I know that you sent this to us. This is a West Clear. The beer is a tall boy. It's called West Clear from West. It's a West Coast IPA, and the brew is called Wilderness. And for those of you who are not watching but listening, this has a kind of like a little Arizona creek going on. In the can, you got, it's very, it looks very earthy. You got some, kind of like brick color, and you have a little bit, you have a lot of green, and you got some water going on. So why don't you tell us why you sent this, and if you like it and whatnot?
Well, it's Arizona Wilderness is the name of the brewing company. It's a small local brewing company, actually here in, I guess, Gilbert Chandler, which is where I live at, right? So it's probably like 15 minutes from my house. I went down there. I said, hey, I want the best you can give me. So they said, this is an award-winning IPA.
That's cool.
I need this for my boy. He's got the taste for good IPA. So give me the best. I just drink Bud. Bud Light.
I just make people believe that I know about beer, but I don't know that. The name of the beer is, again, West Clear. The brewery is called Wilderness Brewing from Arizona. This is a West Coast IPA and a 7%. Now, for those of you who are not familiar with this podcast, if this is your first time you're listening to it, IPAs are a style of beer that I really like. One of the things that is very common in IPAs is the amount of bitterness and the aftertaste. They are usually very, I want to say, piney, flowery, very almost like earthy, They have to be bitter. They got to have an aftertaste. That's what is, in my mind, distinctive of an IPA. Now, I am going, the description here, I'm going to read it. It says, brewed with El Dorado, Citra, and Simcoe hops. Now, the hops is the ingredient that provides the bitterness. A lot of breweries use combination of different hops in order to achieve different flavor profiles, levels of bitterness, and so on. So I am going to open it. Are you drinking with me, my friend?
100%.
I know it's 11 o'clock right now where you are, so you're doing morning drinking. That's awesome, dude.
It's 5 o'clock somewhere in the world.
Oh, yeah. Yes. I'm going to pour it. I'm going to screw it up. Here we go.
Smells good already.
Bro, I am a professional.
Yeah.
I am a professional to all the haters out there that have been criticizing my pour. I am a true professional. Remember to like, to follow, to subscribe. Let's do this. Let me take a sniff of this. Smells very floral.
Piney.
Smells piney, yes.
There's no pines in Arizona. It's desert.
Bro.
It's good, right?
It's a little kick in the...
Yeah. That'll wake you in the morning.
Oh, yeah. This is a good way to start the day. I mean...
It's only Wednesday.
It's a great way to get over Hump Wednesday.
That's a week, yeah.
I know you are in the lecture circuit. You have a continuing education program, correct?
We do. C2 Education with Ashley Chung. Yep.
With Ashley. Okay.
Yeah.
Ashley, also a dear friend of Bisco. Now, let me ask you, do you have an Instagram page? This is your opportunity to tell people where they can find your courses.
I have my personal Instagram page is, dr.patrick.calalang. And then there's a C2 Education page. Yep.
Okay, but they can go and follow you and then ask you about the continuing education programs that you are
100%.
offering.
Yeah, it's in our bio and so forth. Yep.
Okay.
And they can DM us.
Okay, so what is it? Okay, so how many people have gone through your program since you started it until today?
So we started it a year ago. We did an online course. So the online course, we probably put over 100 people through that. We did 2 or 3 courses. So about 30 people each time, 35. And then our hands-on is, we just limited to 10 to 15. So we've done 3 of those.
So 150,
200 people.
Okay, 200 people.
In a year. Yeah.
And I want to ask you, are those guys are in a range of different experiences and ages and
our online course, we kind of geared it towards the new grads, 5 or less.
Okay.
We realized that, student loans are so expensive, right? They come out of these schools with so much loan that they can't afford CE courses. And so we made the online course like $900 or whatever, $1,000 for 5 years or less. And we gave it 10 weeks, just to address that situation where they shouldn't be penalized because they can't afford CE, So
for sure.
But our workshops, yeah, you're talking, we had some that were fresh out of school to 30 years out.
Okay. Now, do you ask the question in your course, have you experienced post-up sensitivity? Or
100%.
is post-up sensitivity a thing with the people that take your courses?
100%.
100%.
Like when I post on Instagram, My biggest hits or my biggest engagement is post-op sensitivity. It's not how beautiful or whatever the anatomy or whatever of a posterior composite. It's post-op sensitivity. When I do something with post-op sensitivity, it just ramps up.
So you and I, so you agree with me that post-op sensitivity is a thing?
Even if 20 years out, 25 years out, they're still having post-op sensitivity.
So you will disagree with all these guys from academia that said that post-op sensitivity is a thing of the past?
Oh no, they're living in the past.
They're not living outside the walls where they're teaching.
Like I said, we're in the trenches, right? We're in the trenches. We're seeing patients every week, and we see it all the time. Like, we get patients from other doctors. So, like, I have two good endodontists that their moral compass is pointing north. As a specialist, you want to do what you do, right? As an endodontist, you're going to do the root canal because that's your specialty. But I got two endodontists that they will turn the patient away and tell them they don't need a root canal. It just needs to be redone. So they send them our way, and we just tell them, you just got to replace the filling. And they don't need, really, I'm going to say out of all we've done, I've never had anybody have post-op sensitivity afterwards, right?
Okay.
They were having so a common case is with most dentists is they do a filling, patient comes back, there's some pain, so they adjust the bite. They go home,
Okay.
pain, they adjust the bite. Bite. Third time, they say, oh, you need a root canal. Send them to endo.
I personally think there are three types of post-op sensitivity. One that is related to occlusion.
Yep.
One that is related to cracked tooth syndrome.
Yep.
And one that is related to bonding.
Bonding. Yep.
I got those three. Do you see something beyond those three that I'm missing?
I mean, those are the three basic ones. Unless the tooth is already non-vital beforehand.
Okay.
It was already dying to begin with. The cavity was big. Yeah, but those are the three big ones that we always see.
Okay.
Right?
So do you feel that because I know, well, let me rephrase this. Do you feel that cracked tooth syndrome and bonding post-op sensitivity, do you feel that the patient feels something that is similar?
Yeah, actually, you could be. Yeah.
Right?
Yeah, it can. But I would say that the cracked tooth syndrome is more biting, but you could still get that with bonding, right? So, but like a lot of our patients, they'll tell us that, when they floss, it hurts.
Mm-hmm.
With a cracked tooth, it doesn't, it's not flossing.
Right. And what about a sensitivity because of occlusion? Do you feel that is totally different than bonding sensitivity?
Yeah. I think so. In my opinion, it does.
Okay.
Yeah.
So how would you what would the patient tell you if they tell you the symptoms, how would you, at the beginning, how would you say, oh yeah, that's occlusion?
Well, they'll tell me so if it's an occlusal problem, like it's a biting problem, like they left the restoration a little high, they tell me right away, like, I hit this tooth before anything else. I only feel this side first. The obvious, right? So you just adjust it.
Right.
And then you come back, right? So they tell me.
But there is no true pain. There might be a little bit of soreness, but there is no true pain.
Correct. Correct. Like if they didn't bite on it, there's no pain. If they were sitting there just watching TV with their mouth open, it's not hurting them.
Right. And I think you kind of addressed it, but how do you pinpoint that sensitivity is related to bonding? You mentioned the floss. What else?
So, I really go by, like, everybody does x-rays, they do palpation, they do this, they check the margins. But if all of that is normal, now I have nothing to go on but the history. I got to ask them, hey, what kind of pain are you? Are you getting a sharp pain, a dull throbbing ache? You get a pain, on biting, drinking, temperature? How long's it been doing? When was the filling done? So I have to go by history, right? Because otherwise, sometimes I have patients that they come in and, like, the ones with the endodontist, that were done by a previous dentist, they come in and I take an x-ray, no radiographic pathology. I look at the margins of the filling, they're sealed, right? There's no clinical problems and there's no radiographic problems. So now I got to ask him, like, sure it's this tooth, we got to check, right? And so how long has it been doing, how long you've been having this pain and so forth. And I flat out tell him, like, hey, I don't see anything clinically or radiographically wrong with this. If you didn't say anything, it looks like a good tooth. But obviously you're telling me there's pain. You can't eat on it. And it's been like this for months. So there's got to be something wrong with this tooth. So the only way to find out is you got to remove it. So I got to go by history. So some people tell me that, I had a patient that she had pain for a whole year.
Oh, God.
Yeah. And so like the dentist just kept adjusting, and it wasn't doing anything, And so she came and saw me, and I told her, yeah, you're right. So she went to 4 other dentists. All other the dentists said, I don't see anything wrong with this tooth. But the thing is that you got to believe what the patient is saying, because they're telling you there's something wrong with the tooth, right? So there has to be something. They're feeling something. I'm not feeling it. She is, right? The other 4 dentists aren't feeling it. She is. So there's got to be something wrong. The other 4 dentists were just like, oh, here's some, sensitive toothpaste and see if it goes away. A year later, it's still not going away. So I said, hey, listen, I get it. Those 4 other dentists, they don't see anything wrong because I don't see anything wrong. But obviously there's something wrong if you can't eat on it. So we got, only way is to take it out and see what's happening. So, I numbed her up, took, rubber dam. As soon as I started drilling the tooth out, not the tooth, but the filling just pops out.
It's almost like not bonded.
It's exactly right. So whenever I see the filling just pop out like that, it's a no-brainer. In my mind, it's not bonded. It's not a bonded restoration, right? So I knew right then, oh yeah, she's not gonna have any pain after this.
Of course,
we're gonna bond it.
Yeah, right.
So when it pops out, I tell our students, like, if a filling pops out, it's not bonded. It's like a silver filling. I can drill around the silver filling, it just pops out.
Sure.
If you do that with a tooth color filling, which it shouldn't be, and it pops out, it was never bonded.
Yeah. A tooth color. When tooth color restorations are well bonded, you get to the point where you don't know where the composite is and the tooth is.
100%.
Yeah,
100%.
That's crazy. Now let me ask you another question, and because you already answered the second question, which is what is your clinical approach? And your clinical approach is basically to convince the patient that this needs to be removed and exchanged in order to both assess better and most likely get rid of what's causing the sensitivity. Now, when you went to school, did they teach you how to deal with sensitivity? Did they even teach you or show?
33 years ago, bro, we weren't even doing composites in the back. We were doing only them. And we were aligning them. We were aligning those silver fillings,
Glass ionomer, dical, and amalgam.
I know, right, dude?
Right. But I have to ask, because if I assume that and then you're going to say, hey, that makes me feel uncomfortable, you're assuming things about me, hey.
But you're 100% because so I did a GPR in the VA in San Antonio, right? And we still weren't doing composites in the posterior back then. So I had to learn how to do posterior composites because that was the trend. Everybody's going away from silver fillings, right? So I had to learn, and I had my failures too. I was getting it was scary. When I was first doing late 90s doing posterior composites, it was 1 out of 3 were getting sensitivity, right? And I was like, what the F is going on here, right?
And you're reading the instructions.
Yeah. And it wasn't fun, right? It was not fun going to work and wondering if they're going to be post-op sensitivity or who's going to call from last week who's having so I had to find a way to fix this. So I just started looking CE courses and trying to find, ways to make it better. And it's
So what was the first CE course you took?
Oh my God. It was one of those back then there was no internet. There was no. Instagram. It was just mailers. So a mailer came in, it was some guy comes in locally, just a hotel and does a course for whatever, 10, 15 people. So I just saw one on composite and I signed up, and the thing that changed, he made me change, or not necessarily he, but change the way I did things was putting a layer of flowable underneath before packing my composite. So I was thinking I was doing it in the 90s, and now immediate depth and sealing is a big deal now. But we were doing that back then, But the thing was, what happening was back then when we were packing composite, we would pack the instrument, and then the composite would stick to the instrument, pull away,
pull back,
and we had a void underneath it. So they were saying put a little flowable, cure it, and then pack, right? And so that did help a lot. But I was still getting some post-op sensitivity, not as much. It did help, but there was still, and then I took another course saying that, oh, you got to cure, when you take your matrix off and everything, cure again because it's maybe undercured. So I was doing that and it got better again. So I'd say around 2011, 2012, my post-op sensitivity like nearly disappeared. Like I can't remember, and maybe the patient moved. I don't know. I must have some, but like really almost zero.
Okay,
Since, like,
so you
2011.
you saw a steady improvement
Oh yeah.
by doing CE. No, and I want to emphasize
Oh
on this to those of you guys who are listening and watching. Yes, you have to choose wisely where you spend your money for your continuing education. But if you have an issue with a specific type of treatment or you want to get better at something, you got to start somewhere. And, maybe somewhere is the most, cost effective, affordable CE program out there. Whether it's a course, whether it's a long-term program, whatever the case may be. But you have to do it. You have to learn from people with experience. And nowadays, because of social media, a lot of people are very, they're doing a much better job at offering something that is actually good in the quality of it, and they're trying to deliver the best thing possible because you got reviews, you got social media, you got, like, in the past you attended a crappy course, you're like,
dude,
okay,
you get a mailer. It was a crapshoot whether it was a good course or not. You get a mailer in the mail and say, all right, let's try this course.
Right.
Whether it's going to be good or bad.
But also, it's important to say that you're not only going to learn good stuff from the people that everybody knows. You might learn sometimes even more from the guy who's not very well known, or even the guy that might be unknown. So,
for sure.
But doing a C course is important. Continuing education should never stop. I know that you mentioned that you don't get your sensitivity start to go down, basically to a level where it disappeared. Did it disappear because of all the things you were adding to Total Edge? Or did it totally disappear when you changed to Self Edge?
Self Edge. The most drastic change or difference I saw is when I went to Self Edge, it was nearly gone.
What
Even
was
if
it?
I was doing it wrong, right? Meaning like I probably wasn't drying it all the way, the solvent.
Yeah.
It was still like nothing really.
Well,
Yeah.
what was the first Self Edge product that you used?
It was Clearfill SE.
Mm-hmm. Who introduced that to you?
I don't know if it was Spear. I can't remember actually. It was a course because that was way before I did any biomedic stuff. So that was 2011, 2012. So I can't remember who introduced it to me. Because like you would watch a lecturer and you just do whatever they did. I would order the products they had. Like if it was good for them, then I'm going to be like that guy. So I just started ordering all the products. I just can't remember who it was.
Yeah. No, I do remember when it happened to me, and it was. I said, I'm done.
Oh.
I'm done.
Yeah.
Now, you went from Clearfield SE Bond. Are you still using Clearfield SE Bond, or you're using the Protect version?
Protect version.
So you're using the Protect version.
Yeah.
Are you doing Selective Edge, or are you doing all SE?
Total SE. I used to do like Selective Edge, the enamel, but like I've got cases that are 10 plus years old that there's no like marginal leakage, no marginal staining. So I just stopped doing it for years now.
So you're doing just
as long as I aerobrate it, right? Because self-etching really doesn't etch the enamel well.
You see, this is why having conversations instead of taking sound bites, it's important.
Yeah.
Because we could have stopped talking and said, Patrick Calalang doesn't etch enamel with phosphoric acid. Oh, Jeremy, you can take this to the bank. Yeah. But the sun aerabrates it. You know what 100%. I'm saying? You aerabrate it with aluminum oxide, I'm assuming?
Yep. Aluminum oxide.
Yep. So by using
50 microns.
Yeah. So now you've created the micromechanical retention on enamel. You just changed the method, but the process is the same.
100%. Because if I didn't self etch or if I didn't aerobrate the enamel, I would probably get marginal leakage. I would probably get staining all around my fillings. But you're right.
So you're abrading every single restoration with
Everything.
everything.
Anytime I have bonding, I'm going to aerobrate.
What air unit do you have?
So I'm cheap, man. So I got just the Danville, micro etcher, the micro etcher 2. It's like $250. And I've had that since 2010.
Hey, I am not here to judge.
Yeah, don't judge me.
That's okay, but I think it's time.
Hey. Move up to the big leagues, right?
Aquacare. What's the other one?
Crystal Mark, Aquacare. What's the other one? Prep Start.
Prep Start, H2O. Yeah.
But bro, you're talking $4,000, $4,000 or $5,000 to my $200
How much is your golf driver?
Okay, you got a point there.
So would you say, Patrick, that in order, we talked about what to do after you find out that you got sensitivity, but I want to get to this point. In order to prevent it,
100%.
What would you tell somebody who's doing total etch?
Total etch?
Yes.
I mean, I would limit the amount of etching on the dentin for sure.
How would you do that?
I guess it's time-wise, right? They just less time on the dentin.
We haven't done it for so long that we really don't know.
I don't remember. Yeah, I know. I haven't done it for years, but if you're going to do total etch, whether it be total etch or self-etch, I really think, and going to the Bisco experience opened my eyes. Thank you, by the way, because, we had 8, 10 people there, and we all did that, bonding experiment. And obviously Ashley beat us all, right? But
she used 3 adhesives. Remember that?
Well, what she did was she was applying the primer, or I guess the bonding, because it was universal. She did use all bond universal, so she was applying the primer longer than it was supposed to be, and then
she coated it with the resin from Clearfill. Remember that? So she did a little Frankenstein experiment.
Yeah, she did. You're right. But I think the key was that, because we talk about this all the time, is that, and we talk about this in our class, that you have to introduce the monomers into the dentin, right? So what happens with a lot of dentists out there is that it's about convenience. They just want to do they don't read the IFUs, right? They don't read the instructions to follow use, right? And so if it says 10, 20 seconds, they're not doing 10, 20 seconds. But Ashley and myself, I will, if it says 20 seconds, I will do 20 seconds or more. Typically, the deeper I go, the longer I'll brush.
Hold on to that thought. So now, every episode, Patrick, I have something called the row tips. I want in this episode to do the Patrick tips. Okay.
Yeah.
So these tips are usually what we would like for our audience to take. Yeah. And say, okay, of all this nonsense and beer and golfing, talking mumbo jumbo.
You remember one thing.
Yeah. What is it that you're going to take? What are the pearls that I'm going to take home, right? So give me 2 Patrick tips that they can use clinically to avoid sensitivity.
You can start tomorrow, Thursday. Tomorrow morning, start tomorrow. I would tell you, you're going to just, whether it be a 2 bottle or 1 bottle, you're going to take the agent and you're just going to prime. You're just going to scrub. You're going to just keep scrubbing So tip number 1 is read the IFU. That shouldn't even be a tip. That's a given, right? So I'm not going to
Awesome. We appreciate what you just did, because we make a stink about reading the IFU.
Oh, geez. It's IFU is either instructions for use or I effed up, right? I effed up. Right?
Oh!
Can I say that on your podcast?
Oh, bro.
Yeah.
Come on.
It's either I followed, instructions for use, or I effed up, because that's 2 ways it's going to go.
Right.
That shouldn't even be a tip. That's just a given. So I would tell, I tell all my students in our course at Spear, because I mentor at Spear, I tell them, hey,
Wait. Okay. You know, yeah, hold on.
wait. I can open another beer now.
I'm not going to do that. You just,
You're on the clock.
no. You just like, in a very nonchalant way, just said that you're teaching at Frank Spears seminars.
I help mentor, right? I don't necessarily.
So okay, no. Wait, you're saying that you're faculty at Spears?
Visiting faculty.
Faculty,
Yeah.
faculty, nevertheless. I did not know this. Congratulations. If it was easy, everyone would get invited. I've not been invited. I could tell you that. They did invite me to go to UCLA, but not to Spears.
Well,
Hey,
you know, it is an honor, and I'll tell you this,
bro.
bro, really, like, I was like done with dentistry. I was out the door. I had a place in the Philippines. I had a condo in the Philippines. I was going there every 2 months, just packing stuff into my condo, ready to retire there. Right? I was done because I had a bad situation happen.
Absolutely,
so anyway, Yep. So I was done with dentistry. I thought there's more to life than working. So I was out the door. I had one class left. I had one CE left that I signed up for. It was restorative design with Dr. Bob Winter, right? So I just went through the motions. I wasn't going to practice anymore. I was like, I'm done. So I'm just going through the motions, and he taps me on my shoulder, right? So it's a workshop where you prep. You prep.
Who taps you, Dr. Winters or Dr. Spears?
Yeah, Dr. Winter prep. He teaches the course. Bob Winter teaches the course. He taps me on the shoulder. Like, I don't know if you know who Bob Winter is, but like
I do know who Bob Winter is.
A legend, yes. Right? He's like the hand. Yes. He's like the hands of the Spirit Institute, in my opinion. But anyways, he taps me on the shoulder. He's like, hey, did you do these preps? I go, yeah, I did the preps. I'm sitting here, right? So I'm thinking like, what? Yeah, I did the preps. He goes, oh man, have you ever thought about becoming a mentor? And I'm like, I didn't even know what that meant. I was not in the moment. I was just ready to retire. And so he asked me, hey, did you ever think about being a mentor? I had no clue what that was. He goes, well, think about it. And this is like day one, end of day one, maybe beginning of day two. It's a 3-day course. End of the third day, we're all leaving. We're done. And I'm walking out the door, and he's like, hey, Patrick, did you think about being a mentor? And I told him, hey, Dr. Winter, I honestly don't even know what that means. So I was like, what does that mean? He goes, well, you get the concepts, you understand it. Your hands are pretty good. You have good hands. You understand the philosophies. We want you to come back and help teach other students. And from that point on, I was thinking, man, this guy is a legend. Asked me to come back. So he handpicks all his mentors. There's only like 6 of us, right, for this course that's taught 10 times, 12 times a year. And so for me, like he reignited. I tell people like he saved my life, my dental career.
Well, he saved your dental career for sure.
He saved my dental career. And so that's why, I owe it to Spear, and I owe it to Bob Winter. So I wear my hat, I proudly wear.
Patrick, let me tell you something. I think that everyone at a certain point in their career have developed loyalties, and the loyalties are they are a thing that they're non-negotiable. As a human being, they shouldn't be negotiable, right? They're non-negotiable. And you wear your loyalty in your hat. And first of all, thank you for sharing this story. The fact that you were tapped by Dr. Winters during a Spear event, and now you are a mentor at their facility, and that you're actually giving Dr. Winters credit for saving your dental career.
Yeah, I tell
or giving the Spear Center, because of them, you're still, on the saddle, writing and doing your own thing.
Oh, yeah. Otherwise, I was out the door.
Bro, that's absolutely awesome. I have a loyalty to Dr. So. People tell me, well, you're a sold out because you work for Biscop. I said, bro, I don't, working for, Biscop pays my salary. I work for Dr. So. And if Dr. Sa tells me, hey, we need to, we need to do this, I'm going to do it because it's a loyalty thing. You know, and
That's the best bond there is. That's the strongest bond. More than
and as a human being, if you don't have any sort of loyalty towards anything,
Sure.
you're empty. But I do want to ask you. Okay, so you just gave us your first Patrick tip.
I would tell you prime longer than normal.
Okay.
If the IFU says 20 seconds, do at least 20 seconds, if not longer. So my rule of thumb is that the deeper you go, the harder is the bond because there's more moisture, right? Those dental tubules get wider as you get closer to the pulp. So there's more moisture, so it's harder to bond. So as you go deeper, I'm gonna prime for 40 seconds, even sometimes a minute. Because in my mind, I'm thinking, okay, what's another 20 seconds? I would rather spend the extra 20 seconds now than another hour for him or her to come back and redo the filling. Does that make sense?
Of course, of course.
People are like, oh, they're lazy. They're like, oh, another minute, that's too long, or another 30 seconds, that's too long. All right, you're either going to do it now, or you're going to do it next week when they come back and you got to replace the filling.
I appreciate this. Patrick, it's awesome. I'm not going to ask for another beer. I should, but I'm not because I got to keep on doing Excel stuff. I got to turn in reports and admin. With that being said, I want to thank you for your input. Stick around. We're going to do the beer review. Okay, so let's do the beer review. And the beer review right here is West Clear. West Clear, that's the name of the beer. It's a West Coast India Pale Ale from the brewery that is called Arizona Wilderness Brewery. Right? Now, what made you choose this beer? I think you described this is because you went in there, they're a brewery close to you, and you said, give me the best thing you got, correct?
100%.
Have you ever had it before?
Not this beer, but I used to drink there a bit,
A bit? What does that mean?
Yeah, when I was single. Life changes when you get married and have kids.
A bit.
Okay. What I remember.
Yeah. Okay. All right. So, do you think that the ingredients, any of the ingredients that I described, and I'm going to read the description, brewed with El Dorado, Citra, and Simcoe hops for a flavor as vibrant as the West Clear Creek wilderness. Do you think any of those ingredients stand out?
There is no creek in Arizona. There's no creeks here because it's a desert. I don't know where they got the water from.
Maybe the water that is flowing inside the cactus. Okay.
It must be because I don't know.
Okay.
But I tell you, I'm on my second one. So
yeah. Okay. Okay. So here, is the aroma and the taste up to par? Yeah. I want to say yes. What do you think?
100%.
100%. 100%. Yeah. Now, if we're thinking like layman, which we both are, it doesn't matter how sophisticated we think we are. We're just layman.
Regular.
100%. 1 to 5, how would you score this beer today?
I'm going to go 4.1.
Woo! Love it.
Hello, Bonding and Beer listeners. This is Jeremy, the producer. Sorry for the interruption. Rolando forgot to give this beer a score during the episode, but he did give his rating once the cameras turned off. He agreed with Dr. Calalang's 4.1 score, and he hopes to one day visit Arizona Wilderness Brewing with the hopes of having a West Clear IPA in person, on location, with Dr. Calalang. Now let's get back to the show.
If in Arizona or close to Arizona, if you're able to find Arizona Wilderness Brewery, you should try West Clear, which is a West Coast India Pale Ale, and that is going to make you happy. Don't you think, Patrick?
I'm happy already.
Okay, so Dr. Howard Burns. We get questions, and Jeremy lists them here and puts their name in. So question number 1, how do you figure out which type of post-op sensitivity you're dealing with? Patrick, why don't you answer that?
I mean, there's a lot of ways. Everybody does radiographs and then, clinical testings. But like I said, you got to also put history into it. How long has it been? What triggers it and so forth.
So having a conversation is important.
Probably
more important. It's a very important part of the process in order to combine it with all the other kind of like standardized methods for diagnostics.
That's why I always say we have 2 ears and 1 mouth, right? You got to listen, right? So
Yes.
we're so readily to tell them what they need when we don't listen to what their complaint is.
Right. Okay. That's a good one. Now, Alejandra Ramirez says right here, what are my options when my patient is experiencing post-op sensitivity? Patrick?
I mean, depends on what's happening, but I would say replace the filling. I mean, I don't know. I mean, if they gave you more information, but I would say if everything looks normal.
I think that the people that are following us, subscribe to our thing, they're really focused on bonding, or they want to hear about bonding. So this will be a bonding, triggered sensitivity.
Oh yeah, no. So the best way to stop post-op sensitivity is to prevent post-op sensitivity, right? That's the best way to stop it. Just prevent it, and that's really bonding. Is if you can bond, it's going to make life so much easier for you. Just follow the IFUs.
Follow the IFUs. Now, Martin Weinman, whatever, it says, what is one thing you want to do before you leave this earth? I want to be able to go through a surgery. And after I leave the surgery, I want to be able to take the medication that has been properly prescribed by my surgeon, rather than having my wife make a decision of the type of overdose that I need to die from.
I hear you.
I want to have a competent individual by my side that is going to give me.
Wait, does she watch this podcast?
Oh, 100%. Oh. She does watch this. And I love her to death. What? But the fact that I say competent and I love her in the same sentence, that speaks a lot. Yeah. Okay. Well, yeah. It balances out. Balances out. Thank you, Dr. Calalang, for attending our podcast. Thank you for sending us this fantastic beer. Thank you for sharing a very important piece of your life. Your loyalties, where they stand. We totally understand where you're coming from, because we are the same. And to all the people that, that are watching this, are hearing this, again, share, like, subscribe. Thank you so much.
Cheers. Thank you.
Yeah, Jeremy, the producer. We're done over here. Let's go. Are we good? All right. Tell me when. Hello? Yo.
When you're ready.
Okay. Okay, hold on.